on May 18th, 2014. I took him to the hospital. He didn't feel good, and they did x-rays, and we were waiting, and that's when we met Dr. Liu. And he explained that he had small cell carcinoma, very aggressive cancer. It's one of the most aggressive cancers. He told us how he's going to address it, and that was the day we found out. It changed. I was like a nanny to these two little girls that I had been watching for 5 years, and I had to drop that. I am retired, and just took over and went to his chemo, and he started out really, really good. No side effects at all. Even Dr. Liu was surprised. And then he went to a different type of chemo, which really made him sick. We saw Dr. Liu, and he explained that we could try another one. It was my husband's choice. And if he wanted to continue with the treatment, my daughter asked, well, if he quits the treatment, just, calls it quits, how long would he have? And Dr. Liu said maybe 3-4 weeks. But my husband decided to continue, and so we continued. We've been married 36 years, and he was a mechanic for 40. We met down in Sacramento and got married a year later. I retired from the grocery business, and we decided to move up here. Well, it started out going, to the chemo treatments, and like I said, he did really, really good. So it was just like a daily routine until we got further down. He had developed a small blood clot right here, and so Dr. Liu suggested the Lovenox shots, and I had a nurse at Trios, and she taught me how to give him his shots. And so I did his shots. Poor man, he hated them. I went from arm to arm to belly, this side of the belly to that side of the belly, and down the road, his belly was so black and blue. And so Dr. Liu put him on Xarelto, the pills for that, and the blood clot, eventually it didn't do any harm. And he started to fail, and then on that day he was going for a CT scan. He had collapsed, and we got him in the car to the hospital, and then we learned that there was nothing more, and so he went on hospice. They came in, set up everything, his oxygen, everything, and they were awesome. Everybody that we came across was awesome. But towards the end, when I knew he stopped talking, he wouldn't eat, and I had to just give him water through a straw, and I would sit next to him and hold his hand and just watch him. And then he finally passed on July 14th, early in the morning. And after watching him and how he fought, I really thought of it as a blessing, because he was free and no longer in pain. I miss him like crazy, but it was a blessing. Being the caregiver is a job, but it is with your loved one. It's just a journey. You're right beside them. Listening to them, understanding, and what my role was And when it came to all the meds I had to give them, they taught me everything. The infusion girls are fabulous, and Dr. Lou and his staff, and they were all just fabulous and caring and loving people. And that helps so much. And it's amazing when you are faced with something like that. It's amazing what you can do. And I just did it, you know, all the way down. When we went to the doctors, we were there, and we talked and we laughed, and I saw when Keith was in the hospital, he had to be put in the hospital several times. We saw Dr. Lou there, and we just became like family. And I can't say enough, because they're the most caring, giving, loving people all the way down the line. And that first day in hospice, when Dr. Lou and Amber came over, and that, it just was super, just absolutely super. I'm still in touch with them today. They actually are family, you know, and just knowing how much they cared was just, it was wonderful, just wonderful. Just being there by their side every day, doing what you can do. It was a wonderful commitment for me to know what I was capable of, and helping my husband. It's just, it was just heartbreaking, you know. But I did it, and I wouldn't have it any other way at all. That is his urn, and my son-in-law's father made this out of bark from a tree. And this is where he is today. He's right here with me. Never give up. Never, ever give up. He wore a t-shirt, Willie Nelson, you know. And on the back, he had the white ribbon that represented lung cancer. And it said, "Refuse to lose." And he fought. I'm not gonna lie, he fought. But he didn't win, you know. But never give up. Never, ever give up hope. I miss him. I miss him, you know, of course. But he's right here with me.
Good evening, everybody. My name is Dr. Lou. Linda, thank you so much. Thank you for that video and allowing to share something so personal and I know very painful, and to relive those painful memories seemingly all over again. Sorry. When I think of Keith, I think about how he has remained so brave throughout his fight against cancer, even at the day of his diagnosis. But I also saw Linda. He looked terrified. He looked very helpless and very worried. And I knew that while my focus should be on Keith as my patient, I could not help and ignore Linda's genuine concerns and the emotional turmoil. She also needed our support badly. Oftentimes we get so focused on treating the cancer, not the person. We forget that there are family members, loved ones, friends, you know, who are going through this emotional turmoil. At Trios, we believe in not just treating the patient, but the entire family. I think that's what sets us apart, what makes us unique, and what makes our care more personal. When my father was diagnosed with colon cancer, it was so important for him to pick an oncologist that would not only take good care of him, but take good care of his family too, us. I'm the only physician in my family, and so everybody looked up to me for answers. He wanted somebody to work with me. He wanted somebody to answer all our concerns and our questions. The truth is, and the hard reality is, doctors don't always have the answers. We don't always have cures for every single cancer. And sometimes what our patients simply need is, that hug, that extra time in that visit of theirs, that 15-minute visit, an extra time to that to listen to their other concerns about life in general, a pat on the shoulder, a pat on the back, kind words. We forget how powerful a human touch can be. We forget how powerful kind words can be. Sometimes even more powerful than chemotherapy. Throughout Keith's battle with cancer, we knew and we realized that his cancer was becoming more resistant to treatment. But not once did he show signs of wavering. There was that one day that he wore a shirt that had this famed 4-letter word followed by cancer. I'm not going to say what that word is. You all can guess what that is. And he had this huge grin on his face. And his mischievous smile. He always came to clinic with a smile. We always had a good time and laugh about things. He taught us one important lesson. He taught us how to fight. He may have died, but he died defiant. When we lost Keith, when he passed away, we did not just lose a patient. We lost a good friend, a family. We lost a hero. And it affected me and my staff very, very deeply, up till this day. When we say that at Trios we are with you for life, we actually mean it. Keith did not lose his battle with cancer. He actually won. So Keith, wherever you are, you're sorely missed, my friend. We miss you so much.